The RNFL thickness graph is a useful, quick overview of the nerve fiber layer appearance. It uses the circular tomogram cutout that surrounds the optic nerve. The RNFL thickness from this single tomogram, as seen on the top, is then presented in a standard T-SNIT graphical display shown below. Recall that a T-SNIT display is simply a quick way to say that the circular tomogram is best viewed following along from the temporal zone to the superior zone to the nasal zone to the inferior zone and back again to the temporal side. The T-SNIT display is often with both eyes overlaid upon the same graph to allow for a comparison. It is important to remember that the standard T-SNIT graph of the RNFL data has a double-humped appearance. Why? Because the superior and inferior poles have more neural tissue than the nasal and temporal aspects. When looking at the graph, you should look for the curves to follow a smooth pattern. Sometimes the RNFL thickness values are higher than what we might expect. That can be seen in this image of a patient with right-sided swelling of the optic nerve. Note that the pattern of the left eye is normal. In other cases, the superior and inferior peaks are lower than what we would expect. We call this blunted or thinning of the peaks, and it's a sign that you may be looking at a case of glaucoma. The colored background gives you some idea of statistical significance, but as subtle variations in anatomy can cause tilting of the nerve and shifting of the peaks, you are better off using the T-SNIT RNFL graph to give you a quick idea rather than a final answer. Are you ready to try your hand on some real images? Join us at eyecarepd.com.